How to treat erectile dysfunction. Are you having trouble sustaining an erection during sexual intercourse? As many as 50% of men over 40 have been there, too. As millions will attest, erectile dysfunction can be deeply frustrating and have a negative impact on both relationships and self-confidence. The good news is that there are many ways to treat erectile dysfunction. From simple lifestyle changes to medication to herbal remedies. If you want to know how to overcome erectile dysfunction so you can feel happy in the bedroom again, keep reading. Method 1 of 3. Making lifestyle changes. 1. Get past your dislike of the doctor's office. Millions of men who experience erectile dysfunction, ED, each year are too embarrassed to talk about it with their doctor. ED is a very common disorder, but it is not considered to be a normal part of aging. ED is often a signal that there is an underlying problem that needs to be treated. Before attempting to overcome ED on your own, it's very important to make an appointment with your doctor and clear up any other issues that might be affecting your ability to sustain an erection. Talk to your doctor about your vascular health. 1. If you have high blood pressure, high cholesterol, or high blood sugar, it's possible that one of these conditions has damaged arteries in your heart, which can lead to ED. Heart disease and diabetes are two serious conditions that often start with ED. 2. If you have one of these disorders, getting treatment should help you overcome erectile dysfunction. 2. Exercise regularly. Really, make it a priority to get outside or go to the gym and walk, run, swim, bike, or do strength training at least 4 times a week. According to a study conducted by Harvard, walking 30 minutes a day caused a 41% drop in risk for ED. 3. Getting regular exercise aids circulation, getting your blood pumping through your entire body. When it's time to sustain an erection, better circulation is key. 4. 3. Keep your weight down. Larger waistlines are associated with higher rates of ED. 5. Putting in the work to slim down can lead to huge improvements in the bedroom. Sure you're eating a healthy diet loaded with plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. Avoid processed foods and foods made with refined sugars and flours. Replace high-calorie drinks with water or unsweetened tea. Eat healthy snacks like nuts, carrots, and apples instead of reaching for sugar-laden power bars or fast food. 4. Quit smoking. Smoking can make ED worse, since it interferes with your circulatory system and is linked to diseases that cause ED. If you're having trouble sustaining an erection, now might be the time to give up the cigarettes for good. If quitting doesn't seem possible right now, cut back as much as you can. If you can limit your smoking to a few cigarettes a day, that's better than smoking a pack. 5. Avoid alcohol. Alcohol is another substance that has a huge impact on erections. After a few drinks, many men of all ages find it much more difficult to stay hard. 6. Exercise your pelvic floor. The pelvic floor helps the penis stay hard during erections by pressing on a vein that keeps blood from leaving until the erection is over. 6. Men who exercise their pelvic floor have better results than those who rely solely on lifestyle changes to correct erectile dysfunction. So how do you strengthen this internal muscle? Kegel exercises. Define your pelvic floor, tighten the muscles you'd need to tighten to stop your urine flow. Tighten and release the muscle 8 times, then rest and do it 8 more times. Continue until you've done 3 or 4 sets of 8. Do Kegels every day at least once a day. Method 2 of 3. Overcoming anxiety. 1. Remove stressors from your life. Anxiety is one of the biggest culprits when it comes to ED. If you can find a way to de-stress, you'll be more likely to maintain erections. Think out the biggest sources of stress in your life right now. What can you do to give yourself a break? If your schedule is packed from morning till night, think about what you can quit to give yourself more downtime. Turn off your electronics at least an hour before bed. You'll get better sleep, which is essential to de-stressing. Spend more time outside. Getting fresh air and being around nature is a great way to calm anxiety. 2. Practice mindfulness. Do you find yourself getting distracted by worries instead of living in the moment during sex? Mindfulness is the act of being completely in the present, both physically and mentally. Clear your mind and focus on the sensations your body is feeling during sex. 7. If sex has become routine and understimulating, mix things up by adding new scents, textures, and sounds to the mix. For example, use massage oil or put on some music that gets you and your partner in the mood. 3. Communicate with your partner. Do you feel comfortable and PTED when it comes to your sexual performance? If you're worried about meeting your partner's too high expectations or living up to some kind of standard, it will be harder to maintain an erection. It's called performance anxiety. If you think your partner's judgment might be hindering your ability to have satisfying sex, you need to communicate your needs and find ways to make your sexual environment more inviting. 4. Learn more about sex. If you have deep-rooted anxieties or guilt related to sex, these negative emotions might be causing your ED. Learning more about sex can be a good why to feel more comfortable with your body and better understand your needs in bed. 8. Read up on sex techniques or take a sex-positive workshop as a way to open your mind to new possibilities and increase your comfort level. Method 3 of 3. Trying medications and therapies. 1. Take an ED drug. Such drugs can help men maintain erections for several hours at a time. They work by enhancing the effect of nitric oxide, which the body produces naturally to relax and increase blood flow to the penis. 9. If you're interested in taking a drug specifically geared toward treating ED, talk with your doctor about getting a prescription. It's important to treat the underlying problem that might be causing ED, rather than relying on medication alone to deal with the issue. ED medications might not work, or might be dangerous to take if you're taking certain other medications or have had a stroke or heart disease. 2. Consider injections or suppositories. If you'd prefer not to take medication, it's possible use either an injection or suppository to administer L-prostadil into the penis just before you want to have an erection. Side effects can include pain and the accumulation of fibrous tissue in the penis. 3. Look into testosterone replacement therapy. If your doctor determines that your ED is being caused by low levels of testosterone, then testosterone replacement therapy may be the right solution for you. Talk with your doctor about starting a program. 4. Try a penis pump. This device is a hollow tube with a hand pump. The tube is placed on the penis and the pump is used to create an erection. A ring is placed at the base of the penis to keep the blood from flowing out. If you're interested in trying a pump, talk with your doctor about which model is right for your needs. 10. 5. Consider implants. Either inflatable or semi-rigid implants are placed in the penis, enabling you to have greater control over erections. Since implants can cause infections, doctors usually advise against them unless all the other methods have failed. 11. 6. Look into natural remedies. If you're not interested in drugs and devices, see a homeopathic practitioner who can advise you as to what natural remedies might help manage your ED. While no studies have been conducted to prove that these remedies work for everyone, some men have found that acupuncture, herbal medicines, and herbal Viagra can be useful. Don't take supplements or extracts without consulting with a physician first. Korean red ginseng, deoxyribonucleic acid, and L-arginine supplements have been used to great effect by some men.